From day one of admission to the critical care unit, one of the first things that the physiotherapist will do is investigate and find out what the patient was like before they were admitted and before they became unwell. Our goal from day one is always to try and get them back to this level of physical well-being and function on discharge from hospital. For survivors of critical illness, a stay on the intensive care unit can really be separated into two sections: intensive resuscitation followed by intensive rehabilitation. During the intensive resuscitation phase, the role of the physiotherapy is maintenance and preventative therapy, so ensuring that we're maintaining the joint integrity, ensuring that we're maintaining the respiratory function and the muscle length as much as we possibly can. Once the patient is medically stable, the rehabilitation phase will begin. When we're rehabilitating these patients, we have to do a comprehensive assessment of them and then set patient-agreed and patient-specific goals. In the early stages, this may be something as simple as sitting out of bed. As the patient gets better, though, these goals will change, and we may be looking at things like returning to work or returning to a high level of physical function, such as running, in the later stages. Some critical care survivors will fit under established care pathways, others won't. But a lot of these patients can have complicated needs that aren't always addressed within these current pathways. Proactive care planning can help us to identify the complex needs of the critical care survivor so that we can get the best outcome for the patient that we possibly can.
The benefits of multidisciplinary care planning mean that non-physical signs can be identified. This may include symptoms such as difficulty with sleep, lack of concentration, frustration with the family that's out of character. These kind of things can be identified and dealt with by a multidisciplinary team. A smooth transition in the care planning process between hospital-based and community-based care is essential.
We know that the challenges that some patients can face can be complex. So as occupational therapists, we are involved with these patients from an early stage within the critical care environment to address some of these issues. Within the rehabilitation team, we make goals with the patient to enable us to complete goal-directed therapy to help them to achieve their day-to-day tasks. In the community, the occupational therapist will continue this with both cognitive and physical rehabilitation, as well as looking at the home environment to make any modifications that will facilitate the patient's independence. Independence can mean different things to each patient depending on the tasks that are important to them. This can include managing sexual dysfunction, managing continence, a problem scar, or returning to work or school. Early identification and goal setting with each patient is crucial in the care planning process.